Good afternoon, and thank you for joining me for the daily COVID-19 update here in Erie County. I am happy to report that we have no new positive cases of COVID-19 to report today in Erie County. Our total remains at 40 positives, and we now have 1,129 total negatives. While we do not have any new cases to report, I'm also happy to share with you that we have 17 out of our 40 cases who have recovered, and we still have no deaths of Erie County residents. The contact tracing investigations by Erie County Department of Health continue on the cases we have. In the state, we now have heard that the numbers are 25,345 positives with 584 deaths. That is 1,146 new cases and 60 new deaths in the past 24 hours. Warren County remains with 1 case, and Crawford County has 16. And Allegheny County, which includes Pittsburgh, has 893 cases and 24 deaths. And as always, I ask you to please stay at home unless you absolutely must go out. People have been asking why they have to stay at home and why only essential businesses are open right now if we have so few cases in our community. And that's exactly why, because it's working here in Erie County. What you are doing for all of us is working. If we were not taking these precautions, we would likely have community spread like so many other counties across this country have. And I guarantee you that our numbers would skyrocket, and it would take much, much longer for us to get back to work and most likely result in much, much more illness and potentially death. To protect others, please wear a mask when you are out, whether you're at the grocery store, whether you are at work in a life-sustaining business, or even whether you are out walking. I take my mask when I go walking, and when I come upon people, I put it on to protect them. And always, always stay at least 6 feet away from anyone who is not living with you in your home. I understand it's not exactly fashionable and maybe uncomfortable to wear a mask, but you should not feel odd about this. You should feel like you are a lifesaver, because that is who you are when you wear a mask. You are wearing a mask for the others that you come in contact with. And I ask everyone to wear a mask for everyone else that they come in contact with. We understandably receive a lot of questions regarding our testing capabilities here in Erie County, and many are quick to attribute our low case numbers to a lack of testing. While you are not wrong that we haven't had adequate testing according to what we would really like to have, neither have any other counties. But we do know that about 25% of the people who are positive for COVID-19 do not even have any symptoms. But we are not aware of any bottlenecks, any testing backlogs, or any shortage of supplies here in Erie County for those who are deemed necessary to be tested. Testing is being done on a daily basis through our hospital testing sites as well as through some private physicians. It can take somewhere from 1 to 5 days sometimes to get those results back. And of course, this is something that has really been an issue for so many of us. But as I've mentioned, we have 1,129 total negative tests here in Erie County. And please remember that only those who are symptomatic are getting tested at this point. So please be aware of the symptoms you might have of a cough, a fever, shortness of breath, and even the potential loss of smell and taste. The symptoms may appear in a few days, such as maybe just a couple days after you have been infected, or sometimes as long as up to 14 days after exposure. Reported illnesses have ranged from people with little to no symptoms to people who of course are severely ill on ventilators and some dying. If you think you need to be tested, contact your doctor and talk to him or her about your symptoms. If you don't have a doctor, you can call the health department at 451-6700 and they can refer you on. Those with little or no symptoms are the ones who are really the biggest risk of spreading COVID-19, especially if you aren't taking precautions like wearing a mask when you're outside of your home. This is truly our greatest risk. There is no expectation of blanket testing here in Erie County at this point. So please do your part, and when you are out, wear a mask. Wear a mask for all those you come upon, in case you may be one of those people who is positive and doesn't know it. And thank those who are wearing a mask for you. Stay-at-home order in Erie County is working. Wearing a mask when people go outside is working. Good personal hygiene, washing your hands often, using hand sanitizer, not touching your face, all of those are working. Our environmental task force team continues to make their field inspections to help essential businesses stay open and do the right thing, and that's also working. Once again, if you need information or guidance, go to eriecountypa.gov or call 814-451-6700 or email us at ecdhinfo@eriecountypa.gov. One number we don't want you to call anymore is the rumor hotline. After reviewing the data and the content of the messages with everyone on our team, we've decided to discontinue this line as of 5 p.m. today. The majority of the calls were being redirected to the health department anyway. So we ask everyone to only use the 451-6700 number for questions or concerns related to symptoms of COVID-19 or enforcement issues. So again, 451-6700 or ecdhinfo@eriecountypa.gov. This is an extremely challenging time for everyone. Today, a campaign called We Got This Erie launched across Erie County to unite us with helpful, uplifting content. We have to be thankful to the many partners, the City of Erie, Erie Downtown Partnership, the Erie Regional Chamber and Growth Partnership, Visit Erie, Erie Sports Commission, Erie Arts and Culture, the Celebrate Erie Committee, R. Frank Media, and Gibbons Creative collaborating to produce this campaign and inspirational video that you will find on any of our social media platforms. So use the hashtag #WeGotThisErie to share your inspiring stories with all of us. Let's all continue to lift each other up throughout this challenging time. And speaking of inspiring, our first responders make us proud every single day, and particularly during this COVID-19 pandemic. So let's celebrate them during National Public Safety Telecommunicators Week by sending our first responders, those who answer your call when you dial 911, a note of thanks at public.safety@eriecountypa.gov. That is public.safety@eriecountypa.gov. This is a change from the email that I incorrectly said yesterday. Finally, I mentioned yesterday that Pennsylvanians can visit pacareerlink.pa.gov to search the COVID-19 job portal launched by the Department of Labor and Industry. And locally, we have our Northwest PA Jobs Connect, who has many, many resources for those who are searching for jobs and for businesses looking for employees. So now I have Janet Anderson with me today, who is the director of the Northwest PA Job Connect, who will share more information on that. Thank you for joining me, Janet.
Thanks for having me, Kathy. And good afternoon. Northwest Pennsylvania Job Connect and our operations arm, the Pennsylvania Career Link here in Erie County, is open and providing virtual services to all of you. We are a partnership organization in the 6 counties of Northwest Pennsylvania, made up of many partners that would have services available to dislocated workers, adults, youth ages 16 to 24, and businesses. The staff of our Pennsylvania Career Link have at home laptops and cell phones providing services so that they may provide services, to all of you from a distance. Since our closure on March 17th, we have been providing services. So how can we assist you? If you're youth, we still have work experience. Some of our youth were in work experience, and again, these are 16 to 24-year-olds, and those individuals had to leave their position because of non-life-sustaining business. We've been able to find additional work experience for some of those that were interested, and we will continue those existing work experiences when they come back. We have supportive services for those youth. If they were living on their own, and had a lapse in their employment, we will be able to help them with rent, utilities, and things such as that to help them get by until they get back to work. We are providing them online training opportunities and also job placement. There are many employers that are looking for individuals for job placement, so we are working with them one-on-one. Our adult population, similar to the youth, many were involved in work experience called on-the-job training. If they were relieved of that position, we are able to help them with supportive services. While they wait for their unemployment, we're able to help them with online training and job placement to another position if they are looking for that. Our dislocated workers, and there are many of those, these are individuals that are hopeful to go back to their previous employment. For those individuals, we have supportive services. While you are waiting for your unemployment, you are eligible for our supportive services to help you make your mortgage payment, to help you pay for groceries, utilities. We are working, as I mentioned, we are a partnership organization, so we are working with many organizations to help you make those bills current, keep them current. We'll help you with on-the-job training and training opportunities. This might be a great time for you to consider doing a certificate program, honing your skills. We have many online programs that can assist you, and we are able to pay for those at this time. We also are helping individuals with jobs. Our employers. Many of you are hurting, and I have been involved in many conversations where individuals that are small businesses are trying to figure out their future as well. We are able to help you if you have jobs that are open that you're trying to fill now or in the future. If you are a life-sustaining business and you are looking for employees immediately, the state has put together a jobs portal, and we are able to connect you with that. We also are providing supply chain assistance through a portal at the state. The call to action portal is one where you may, as an employer, be able to become a life-sustaining business. So we are helping in those regards. We're also working with our employers to assist them in other ways by making connections. NWPA Job Connect, or Northwest Pennsylvania Job Connect, is your local workforce board, and we have information at nwpajobconnect.org available to you in a blog form for job seekers as well as for the employers. You may reach our employees for your service, your virtual services, here in Erie County at 814-853-5254 or 814-853-5829, or you may reach us via FaceTime at 814-853-3942 or Skype at Northwest PA Career Link, all spelled out, NORTHWEST PA Career Link gmail.com. So we're hoping that you will reach out to us, take advantage of the services that we have available. I have only hit on a few of them. There are many others, and supportive services are available to you even if you are going back to a job that you had previously. Thank you, County Executive Dahlkemper, for inviting us.
Thank you so much, Janet. And there really is so many resources out there. I know many people listening and viewing are out of jobs and wonder what is next. Please get on that website, Northwest Pennsylvania Jobs Connect, and see what's available for you. These services are for all of those who are struggling right now without a job, and we want to be out there to help you. So thank you, Janet, for coming in and just kind of going through all of the resources available. Now I would like to turn it over to the media for questions either from myself or Janet Anderson, and today we will start with Talk Erie.
Yes, good afternoon. It's Joel Natale. Mrs. Dahlkemper, the narrative has changed pretty much overnight from a full stop to anticipating a restart of the economy. Are you getting any kind of direction from the state as to what sectors might be included at what times, and also if Erie County would be a part of the early wave of loosening? I mean, we're definitely not in the same boat as the east side of the state.
So when we talk about the whole state, don't forget that I mentioned we had 1,146 new cases and 60 new deaths in the Commonwealth. So we are far from out of the woods here in this Commonwealth as a whole. You know, we believe that we are in a much better place. I mentioned yesterday that there are 34 counties in Pennsylvania whose numbers are higher than us, and we are actually the 14th largest county in population. So we are in a much better place than others, and you know, we are beginning to have some discussions and reaching out to our counterparts on the state level to see what this looks like. But it's not going to be this week and not going to be next week. One of the things that we're a little fearful of, and it was brought up yesterday, you know, will we see some kind of a bump 7 to 10 days from Easter? You know, this weekend passing, and we're people together in a way that could have potentially spread this. Don't forget about those 25% of people who do not know they have COVID-19, not wearing masks out and about, and could be spreading it. So we know we have to keep great vigilance about this, but we also know that we need to start thinking about what does that look like as we begin to loosening up our economy and letting things get back to whatever the new normal is going to be. So we're having those talks, and obviously you are hearing stuff from the federal and the state level too, but everyone is very, very cautious because there is some belief that if you do this too quickly and you have a resurgence of COVID-19 into your community, it often, they think it will come back maybe stronger and be more difficult to contain. So very, very cautious about that, but we certainly are looking at what that might mean. And as we come forward with a plan, then we will certainly bring that forward at these press briefings. Jet TV?
Yeah, hi, Kathy. Samir. So since we are talking about the possibly opening back up down the road a little bit, what would that look like in Erie County? Would that be a gradual, like we'd have X amount of restaurants open, et cetera?
It's really hard to say at this point. We are so early in any kind of conversation. But I think one thing it's going to look like is hopefully a lot more people wearing masks than we even see right now. What we know is that COVID-19 is most likely passed from one person to another. And any one of us could be infected with COVID-19 and not know it because we don't have that ability to test everyone. And so if we wear a mask, we're protecting the other people that we're around from any water droplets that come out of our nose and our mouth that could infect them. And the same thing, if someone else is wearing a mask, then they're protecting us. So I would say that's one thing that's going to have to look like, is we're going to have a lot more of that protection. We're going to have people really keeping that social distancing, that 6 foot distance. We're going to have still the things that we know work, the hygiene and the masks and the 6 feet. So all of those things still have to be part of this, but we're not sure exactly how that looks and how you can gradually reopen the economy in our community. But again, we are speaking, just beginning. We are in the very, very beginning stages of talking about this. Erie Times News?
Yes, Kathy, it's David. When you say these early discussions, does it look like it's going to be county by county, or is there going to be kind of a regional approach within the state, like what we're seeing with the northeastern states, where it might be something where Erie and Crawford and Warren all join together? And have you had any discussions in the last 24 hours with other counties, Chautauqua and Ashtabula, that are outside the state?
No, we haven't. We're just beginning to have some conversations within our own community, and I think we need to think about us and then who else do we need to talk to. But obviously, we have to have very good conversations with our state and our state, Department of Health, who's really leading this effort for the whole Commonwealth, led by Governor Wolf. So that would be the direction we would go.
And then just a follow-up on that, are you able to say, talking with your epidemiologist, that we have apparently hit the apex in terms of new cases, at least?
We haven't determined that for sure, but we certainly have seen this leveling off with no case on Sunday, 2 yesterday that were in the same household, and no cases today. So that is very, very good news. As I said, we do have a little bit of back of your head concern about will we have an uptick in 7 to 10 days, but hopefully we won't. Hopefully people actually did what we asked them to. Last week I said that this weekend and this week that we're in right now are very important times for us, and we need people to be extra vigilant right now in terms of trying to stay home, stay 6 feet apart, wear a mask, and do all those other things we've talked about. So if everyone continues to do this and to do the right thing, hopefully we can get out of this sooner than maybe even many of us thought. But it's still time. There's still a fair amount of time that we are going to have to keep up this very strong vigilance that we are in. Erie News Now?
The governor spoke last night for about 10 minutes or so, laying out kind of his three-phase approach. What were your big takeaways from what he had to say? Was there anything there that during that speech that will instruct your moves going forward?
So I think, the governor, nothing was really surprising in what he said. It is obviously good for him to start talking about what that approach looks like. And we certainly, again, are going to align with our state leader on these things. But I think the one thing he kept talking about, and we all talk about, is we can't do this alone. We can only do this if all citizens help us do this and really comply with whatever directives are given as the experts in this area really come forward with what this plan can look like.
I know he didn't lay out a timeline at all last night. Have you heard anything on some semblance of a timeline from the state, or haven't discussions even reached that stage?
Discussions have not reached a timeline yet. I mentioned how many deaths and how many new cases we still have in Pennsylvania. It is still raging, particularly in other counties. It seems to be, still more concentrated in the east than in the west in terms of where it's raging. So, we're probably in a bit of a different position than they are. But even just to the east of us, Buffalo, the Erie County, New York, has cases well over 1,000. And so not too far from us, some of the counties have very high numbers. So we're going to be very cautious as we go forward. And we're going to take direction from the experts on the state level and the experts within our own county here. We have another, I believe, media outlet with us today. I think Penn Capital Star, are you on the call?
Hi there. Yes, I am. I actually had a question just for Janet Anderson, but she answered it already for me. So we are all set here for Penn Capital Star.
All right. Well, I'm glad to hear she answered it. She's very thorough in what she had to say. So thank you for joining us today, though. Talk Erie.
Thank you for having me.
Sure. Talk Erie. Do you have any questions?
Yes, I have a question about the testing, and again, I appreciate you elaborating about the lack of testing. We're down to 16 tests yesterday, And obviously, to man those significant, situations at UPMC and at AHN, it's an expensive venture. Do you have any idea, what are they telling you about the efficacy of keeping that testing facilities available, number one? And number two, is the bar still so high to get a test? I mean, do they still need to, have a very number of symptoms and have proximity and all these different things in order to get a test?
So we still, as far as I know, they, and I should say they because it's it's our acute care health entities that are doing this testing. Excuse me, they still are requiring, that people be symptomatic, or they will sometimes test people who are on the front lines, our doctors, our nurses, those frontline healthcare workers, for example, who may have been exposed. But it's also important to realize you may have been exposed, and as I said, your symptoms may not show up for 2 to 14 days. And you may test negative if we test you in the first couple days, but you might become symptomatic, 5, 6, 7 days out, and then you would test positive. There has to be a certain viral load, and I'm no expert when it comes to this, but I've heard enough discussions around this. You have to have a certain viral load for the test to read positive for you. And so that's why some people have been tested and they test negative, and then they have symptoms that become worse, or maybe they were asymptomatic but were tested because they fall into one of these special categories, and then they become symptomatic. And so that's the quarantine piece. That's why when people are exposed to somebody, even if they test negative, and we've had some incidents of this where people have actually been tested negative, but they're still told to stay in that quarantine for 14 days, and then they could become positive, later on. And so that's why it's so important for people to follow the directives that they have been given, and they are following them. I think for the vast majority are, and that's why we're seeing so much great compliance in Erie County and seeing our numbers really low. And I'll go back to what I've been saying almost every day. Very few counties have the ability to do what we are able to do here in terms of this contact tracing and really giving people the instructions about what they need to do to assist this community. So, 14 days can be like a long time for most people, but it's actually in our lifetime a very, very short period of time in order to save the lives of people we care about. And that's why people, I think, are willing to do this and to help us in this venture of containing COVID-19.
Quick follow-up.
Sure.
Did you have a number of those quarantines just yet?
I do not. They are working on that for me, but they had not gotten that. It's not a number we put in NEDS, and so it's going to be a little bit more work to go back and try to figure that out.
Thank you.
Sure. Jet TV.
Yeah. Hi, Kathy. So yesterday we talked about those rural areas within Erie County and testing. So I guess has there been any effort to possibly put a satellite testing or collection center or site out in those areas? There's
been no further effort. We haven't heard that there's any real struggle with people in those areas to get their get testing done. And actually, the conversation has been more about how can we maybe open up further testing within maybe our very low income areas within the urban population. So that has actually been more of a discussion than the rural areas. We have not heard of people in the more rural areas not being able to get tested or not being able to access the testing sites that are out there. So if anyone has trouble with transportation and they live in the more rural areas or even in an urban area, I ask you to call 451-6700 and tell our health department about your struggles, and we'll find you a way to get testing. What we don't want to happen is we do not want people who think they may be positive not go get tested because they don't have health insurance, they're concerned of the cost, they can't get transportation, they don't have a doctor, any of those myriad of reasons that people might say, well, I'm not going to go get tested. No, if you have symptoms, we need you to get tested. not only for your own sake, but for the sake of those who you know and love. So please, please go get tested and call us at 451-6700 if you have any barrier to getting that test and you are symptomatic. Erie Times News?
Yes, Kathy. First of all, thanks for giving us the number of people who have recovered. Wanted to see if we had information on cases by race or sex at this point.
So, thank you. I asked for more information. I asked for the zones where those people came from, and I'm supposed to be getting that information. I've also asked for a breakdown on race. And I think Dr. Levine today at our press conference spoke about the race issue with the NEDS system. In the beginning, they weren't collecting race in that system. And so, because that wasn't a category in there, my team wasn't either. So we're going back and try to do some retracing. So we know some, but we don't know all in terms of their race. So we're working on that, and when I get those numbers, I will bring them to you. But it's a little bit of work to go back and find that.
And what also kind of sparked me is you talked about the importance of trying to get a testing center in the low-income area. Is there anything to indicate? I mean, we know how many are in the city of Erie with your zone map, but do you have any indication on if we've seen a disproportionate share in low-income areas?
I don't really have anything that indicates that, but I think the concern, honestly, is more about just kind of the overall issues with just health disparities in that particular population, and sometimes maybe the lack of trust of that population with the health system. So part of the discussion has been around maybe this would be a way to even garner a better relationship, not only for COVID-19 with healthcare providers, but maybe overall, and how we can all take this moment, take this crisis to learn and to find a better way so that in the long run, health disparities are actually decreased and level out amongst all people. So that's really what that was more about than believing that we have some kind of disparity around the testing for COVID-19. But I go back to what I was saying just a few minutes ago. If there are people in neighborhoods, people in homes, people out there not going and getting tested because of the barriers that they might perceive are there, we are going to make sure those barriers go away. You will not be charged for getting a test for COVID-19. We can get you the transportation to get you there. We can connect you with a doctor. And those are the kind of things that I think sometimes fear of the expense of this and what this might mean for them might keep people from going to get tested if they don't have insurance, for example. And those are the kind of things we want to make sure people don't have a barrier to. Erie News Now?
Hi, as you look to get rid of the rumor line, which I know you were staffing with librarians, I wondered, any more talk of layoffs in the county? Have you looked into that at all more, just as there are fewer and fewer jobs out there for people and as this pandemic stretches on, or isn't that something that you've had to really look into yet?
So like every entity, we are looking at our employment situation. We're looking at this whole COVID-19 pandemic and how it affects us in terms of our fiscal situation. So we are having discussions ongoing and looking at this going out, and as we come forward with a plan, we will inform our employees first, and then we will inform the media after we have a plan. But we are looking at continuing to be good stewards of the taxpayer dollars, and of course that involves our employees.
Is there a tipping point with this where you say this has gone on for X number of days, or there's only X number of jobs available, where you make that decision that you have to make layoffs, or is it more of a group decision where there's not a specific benchmark, but it's understood it has to happen?
So I think some of this has been, no one really knew when we first started how long this would go on. There's also been an understanding and maybe a better understanding of which employees can work from home, which ones can't. How can we keep our numbers down for social distancing and still get the work done? There's a lot of essential jobs that happen in government that have to continue on. Of course, some of them are very much known. We have to still have corrections officers. We still have to have people answering 911 calls. Of course, the health department is in full force with running the COVID-19, as well as public safety through the emergency management arm, assisting them, and a number of other entities. You still got to pay the bills. You still got to write the paychecks. And all of those kind of things still have to happen. So, but we are getting a better handle, I think, on which employees are absolutely essential and which ones maybe don't have that much to do right now. So that's what we're looking at, and that's how we'll be making our decisions. It's not really a timeline per se, but I think it's as this carries on and moves on further, we have to look at our own house, which we have been all along, and we will make those decisions. And as I said, we will tell our employees first. Any last questions from Talk Erie?
Yeah, just to follow up on Ethan's question, the state is forecasting a $4 billion, at least a $4 billion shortfall. I know they're basing that on income tax. The county tax structure is different. But is your finance director forecasting any kind of revenue shortfall at this moment, and are you tracking that?
So it's really too early to tell, but we are tracking it. And a good portion of our income is through real estate taxes. Now, any person who has their real estate taxes tied up in escrow or tied to their mortgage, those are being paid. So those are already in their mortgage payment, and those are being paid to us from the company that has that those funds escrowed. So we don't know. We'll see. Our tax bills aren't due yet, so that will be better known when they are due. But we do have payments coming in, and so we haven't seen a real issue with that yet. But we also don't know what's going to happen with some of the other funds that come in to us from the state. The state is on a fiscal year budget, and come July 1st, we'll be in a new budget era. We know the state is going to be looking at, as you said, a huge budgetary hole. And so what's going to happen to some of the funding that comes to county government, which a lot of our funding does come through the state. So we have to be ready and aware of all of those things. We are making changes internally to be ready. A few years back when the state did not pass their budget until January, we tightened our belts and tightened them quite a bit, and we were able to keep from having to borrow any money. Many other counties had to borrow money. So we are doing similar things to what we did back then, and we're just making sure that we can survive this in the best way possible, being good stewards of the taxpayer dollars. Jet TV, do you have any last questions?
I do not, thanks.
How about Erie Times News?
Yes. Kathy, I want to go back to the negative cases, kind of two different parts. One, have you done any comparisons with any other counties in terms of whether, especially ones that are in the western part of the state that aren't Allegheny County, are we doing roughly about the same number of tests as, say, a Mercer County or a county like that? And then the second part is, do you feel that only having 16 tests in the last 24 hours, is that due to not as much virus around, or do you think it's something else?
I'm assuming it's because we don't have people who are symptomatic, and so therefore there's no need for testing. That's what I'm assuming, but I don't really have a better answer than that. And I have not looked at the negatives of those other counties, but if you have that information, I'd be really interested in it, David. But, I can see if I can get some researchers looking at that. I do have a couple people doing research for me on a daily basis, and I can have them do that. But if you have that information, let me know. Otherwise, we'll do it and bring that back to you tomorrow.
No, I've been looking at some of the other county health departments and municipal health department websites, and they're not showing it. I just see the statewide rate, which is very high at 25%. Are positive, but I'm trying to find some other county ones.
Yeah, our positives are less than 5%. So, again, that just shows that this county is doing, I think, the right thing. But I will try to get our researchers. I don't know if I'll have that answer for you tomorrow, but I'll try to have them see if they can get some of that research. The problem, again, is they don't have health departments. And so getting those numbers from the state is where they'd have to get them from. And that's sometimes very difficult because we're talking many, many counties relying on the state health department for this information. But I'll see what I can find for you.
I appreciate it. Thank you.
Sure. Erie News Now, do you have any last questions?
Yeah. About the budget, as you talked about maybe having to tighten things up and being good stewards of taxpayer money, any clue on what sort of things we might see go in terms of what would be the first things cut as you try to tighten that budget and balance things out because of the pandemic?
So I don't think this is going to be a big issue, but we are looking at no travel through the end of the year unless it's absolutely necessary. Of course, we have some travel that has to happen. For example, sheriffs have to move people around, and we have some children in care that we are under our care that are no longer in our county for various reasons. And so some of those kind of things, of course, those people who care for them would have to travel for, but that's just one example. We're looking at we're looking at holding any job opening for 60 days, and unless it's absolutely essential that job gets filled faster. And so we're really looking at those type of things. In the procurement side, everyone has their budget, but how can we cut back on the funds that you have for procurement? Are there things that you can hold off and not spend at this particular time? I think we're going to see some savings in areas that we weren't ever expecting, and that would be travel. And we have people who drive around for various meetings, go to conferences, hotels and things when they're at those conferences. I don't think a lot of those conferences are going to happen this year. So there'll be a lot more Zoom meetings and other platforms. So we're going to watch all of that and more. And so as we kind of lay this out, and I can bring more information to you as we have laid it out for each one of our departments. And I want to give Penn Capital Star another opportunity. Do you have any questions before we close out here?
No, we're all good today. Thank you.
All right. Well, thank you for joining us, and thank you all. Thank you again to our media for helping us get this message out to our community. Thank you to our partners at Northwest PA Jobs Connect, Jan Anderson, for being with me today to give you some ideas of all the resources available out there to our job seekers, to those who are laid off, and to our businesses who are looking for workers right now. And please look at their website and look at all of those resources that can help you through this very trying time. And again, thank you all for doing your part by staying home, by wearing a mask, by washing your hands frequently, by not touching your face until you've washed your hands, and doing everything you can to stop the spread of COVID-19 in our community. So please stay home, please stay safe, and please stay calm.